Have you ever walked into a surgery thinking you knew all the risks, the benefits, and exactly what your recovery process would be like? What if I told you there are crucial pieces of information that could drastically alter your healing process, your pain, and potentially your entire life, that your surgeon isn't telling you? Today, we open the floodgates, unveil the clandestine secrets your surgeon definitely won't tell you. This knowledge isn't just a trivial set of tips, it's a powerful compilation that surgeons often skip over, whether due to time constraints, oversight, or the sensitive nature of these truths. We've spoken with leading medical experts who are ready to break the silence and share what they know, risking their reputations for your health and well-being. What's more, at the end of this video, I'm going to reveal which seemingly harmless surgical recommendation could be affecting thousands negatively, and why it's kept under wraps. Stay tuned, as understanding these secrets might not just change your life, it could potentially save it. Virtually every surgeon faces a financial dilemma, driven by a system that compensates them significantly more for conducting surgeries than for providing non-surgical treatment options. In fact, the difference can be up to tenfold. This substantial financial incentive not only affects surgeons but also the hospitals they work with, pushing them towards preferring and promoting more lucrative surgical procedures. Certain surgeons might not discuss specific surgical options if they lack the expertise to perform them. Often, surgeons prefer to treat patients within their own capabilities and facilities. Unfortunately, this can mean they might not suggest a relevant procedure if they are not skilled in it, a practice that, while not uncommon, is considered unethical. Opting for an elective procedure at the beginning of the week is advisable. Many surgeons take weekends off and might not be available to monitor your recovery if you have your surgery later in the week. To ensure continuity in your post-operative care with the same doctor, scheduling your surgery earlier in the week is recommended. Surgeons are known for their need for control. Occasionally, the operating room may experience unexpected events, leading to explosions of emotion from the surgeons. Whether it's swearing or hurling surgical tools, it's important to remember that surgeons, too, are prone to human emotional responses. While it may be alarming, especially if the patient is you or someone close to you, surgeons are trained to handle these intense situations professionally. Errors during surgical procedures are more prevalent than one might assume. It's common practice among surgeons that if a mistake occurs and they correct it without impacting the patient's health, they often choose not to disclose it. They believe that informing the patient about such issues could lead to unnecessary worry or distress. In learning their craft, surgical trainees must begin to perform operations, despite the necessity for a seasoned surgeon's supervision. The idea that novices will be operating might seem daunting, yet it is essential for their development and progression. Inquiring excessively may lead others to distance themselves from you. A patient who frequently questions or displays confrontational curiosity could result in nurses and even surgeons steering clear of their room. Due to their tight schedules, surgeons often find it challenging to field numerous inquiries or manage a patient who is distressed or agitated, potentially resulting in fewer and briefer. Roughly 1/4 of surgical procedures might be deemed unnecessary, yet hospital administrators often encourage physicians to increase their volume of operations and testing to boost revenue. This revenue is primarily derived from surgical and diagnostic procedures. Consequently, it is wise to seek a second opinion from a different facility or clinic before agreeing to any surgical intervention. Should you require a medical device, it's important to inquire whether your surgeon benefits financially from the products they recommend. If your surgeon receives a commission from a particular supplier for each device sold, their recommendation could be biased. It's advisable to ask your surgeon to explain their preference for the specific medical device they recommended. Exhaustion and lack of patience can lead to errors in the surgical suite. Surgeons, much like anyone else, have personal lives yet must perform critical tasks at work. They hold people's lives in their hands daily. It might be a good idea to inquire whether your surgeon has had sufficient rest before undergoing a procedure. Although they might not disclose the complete truth, posing the question allows them an opportunity to be open their readiness. Doctors are not always present and hands-on in the operating room when training new surgeons. The requirement is for seasoned surgeons to be present, though their involvement can vary significantly from actively engaging in the procedure to merely making periodic checks every hour. It's often uncertain just how involved they will be. Surgeons are understandably concerned about the possibility of legal action. They strive, generally, to be thorough in every aspect of their work, from conducting various tests to ordering necessary laboratory analyses and more. This meticulousness stems from their fear of facing a lawsuit should they overlook a detail or incorrectly diagnose a patient. Surgeons might suggest immediate surgery even when it might not be necessary. When patients are discharged and later suffer serious complications, the doctor and the hospital might face criticism for not acting sooner. This concern about potential future issues encourages surgeons to opt for the swiftest possible intervention. It's reasonable to expect that surgeons will encounter some complications in their work. If surgeon claims not to any complication rates, may suggest that they lack sufficient experience or are not being transparent. Even the most skilled surgeons occasionally err. It's wise to inquire about the success rates and experiences of any surgeons you are considering, focusing particularly on their performance during surgeries. It's essential to determine who will be responsible for your care following surgery. Understanding who the post-operative care team includes is vital, as their role is integral to your recovery and immediate health post-surgery. Is your surgeon going to be available in case you need their assistance? Besides inquiring who your surgeon will be, it's equally crucial to learn about the anesthesiologist. Their skill set is essential for ensuring your safety and enhancing your comfort during the operation. Understanding their qualifications and methodology is just as crucial as familiarizing yourself with your surgeon's capabilities. Often, the concerns surgeons truly harbor regarding a procedure aren't merely those listed on the legal consent forms. While these forms enumerate possible risks, surgeons usually concentrate on more nuanced issues, derived from their professional expertise and the specific details of an individual's medical situation. This approach, infused with hope, allows them to address what genuinely matters for each unique case. It's important not to simply take your general practitioner's advice as the definitive best option. Recommendations can sometimes be influenced by personal relationships or other non-medical factors. It's always wise to seek a second opinion, which might just be crucial for your health. It is advisable to attend preoperative meetings accompanied by a relative. Given their hectic schedules, surgeons may subconsciously be more attentive to your case if they notice familial support, reinforcing the importance of your treatment and familial connections. Whenever you're advised to consider surgery, it's important to inquire about the available alternatives that don't involve surgery, and find out if it's advisable to wait. Keep in mind, surgeons might lean towards recommending operations, so it's crucial to speak up and explore all your options with hope and optimism. It's important that your surgical team does not pressure you into making a quick decision regarding cancer surgery. Cancer is a grave matter and, although it's critical to decide promptly to potentially heal, you should not be swayed by any medical professional to expedite your decision-making process unduly. To truly grasp the events in the operating room, one should refer to the surgeon's dictated operative notes. If you find yourself with unresolved inquiries, requesting these notes can be beneficial. While they might be challenging to comprehend, having access to this information provides clarity right at your fingertips. Carrying excess weight or undergoing obesity can present obstacles during the preoperative phase, as it may be harder for medical staff to locate veins for fore placement. Additionally, there is an increased likelihood of post-operative infections. Numerous surgeons are aware of peers in their field who, in their opinion, should not be practicing medicine. It is profoundly unsettling to realize that some individuals entrusted with our healthcare believe that there are other medical professionals who are not fit to practice. This insight underscores a hopeful opportunity for improvement and higher standards in the medical profession to ensure the safety and well-being of all patients. A common oversight many patients commit after surgery is not allowing themselves sufficient rest. It's crucial to adhere to your surgeon's recommendations about the duration of your recovery to avoid adverse effects on your health. Many surgeons suggest opting for a teaching hospital when dealing with severe health issues. These institutions often lead in pioneering medical practices, making them, at times, more advanced than typical hospitals or clinics. Many surgeons engage the expertise of practice management consultants to enhance their earnings. These professionals assist both surgeons and physicians in navigating their business strategies. However, this partnership can sometimes veer towards prioritizing financial gain over patient health, leading to choices that might not always align with ethical standards. These insights provide a behind-the-scenes glimpse into surgical care that could very well change how you approach your medical decisions. Remember, knowledge is power, especially when it comes to your health. Stay informed, stay healthy. Don't forget to discuss these points with your healthcare provider. Hit the like button if you found this information useful, leave a comment with your thoughts or experiences, and share this video to help others become better informed. Until next time, stay curious, stay informed. Discover what's rarely discussed in the surgical suite in today's video. Knowing these top secrets could be a game changer for your surgical choices and your overall health. If this caught your attention, keep watching, share with friends, and engage with us in the comments below. Your health journey matters.